the next version of it. And again, you are seeing what I would say, Shraddha, is you're seeing the different aspects which can help us on the final thing. One of the aspects when we talk about infections and infections as bad as COVID, which has one of the largest or the biggest infection rate, is that its ability to survive long time in the air, right? In the aerosol. People are worried about it right now. And that, think of it, as it spreads, anywhere we go, we'll have that issue. And while we do not have masks, while we have other aspects. So it's a major issue that is there. And the second is that, of course, it also survives for hours and days sometimes on some of the surfaces. And that is something that needs to be addressed as well. And that's where we have a few technologies which actually attempts to address that, where either in the air or on the surface to do that. So one of the, I am being told that we have a colleague from Leafbox here, if I'm not wrong, who actually, that Leafbox attempts to have two innovations which addresses both air-based sanitization as well as surface sanitization. Air-based sanitization may be very important in hospital settings. I think last we just heard Mayur saying that hospitals are one of the worst things you can go to when you are good.
He said it's the most dangerous place right now.
So I think what he meant is that for a healthy person to actually go there, you have a chance of picking up the infection. And for that, you need something that sterilizes, that sanitizes the air around you. So we have two technologies which does it. One is from Leafbox, and another is another fantastic technology, Biomoneta, which attempts to do that. So can we have a Leafbox colleague to share a little bit about their work?
Yeah, we are a startup based in Bangalore. We are completely focused in providing solutions to air pollution generally. So that was the the background of our Leafbox startup. So we have been a part of this KSAP program in C Camp right now. So this solution to this COVID-19 is something, a spin-off that from the technology that we had for the air purifier.
Yes, I can.
Okay, so we had a UVC based solution for air sanitization, air sterilization generally, where this specific range of 255 254 nanometer of wavelength will destroy any sort of viruses or bacteria. So this is the core concept that we had developed in 2018. So we are making use of this particular the UVC to sterilize not only the air but also the surfaces, because it is said that this COVID-19 is being spread majorly because of the contact surfaces, whether if it's our the laptops, mobiles, or even the public places where there are rails and everything. So these surfaces has to be sanitized effectively. So we have created three category of variants, wherein the first category is for surface sterilization, where we will use these bots which will roam around and it will disinfect the surfaces. And coming to the devices, we have a sterilizer box inside which we can place the laptops, mobiles, the gloves, masks, everything to disinfect it. And coming to the air, we have this previously built air purifier, where it has HEPA filters, activated carbon, and the UVC system to sterilize the air.
Have you tested it outside right now?
Yes, we have tested it. We have tested it for influenza virus and a few other bacteria and virus category, but not the COVID-19.
And how are you planning to test this one?
So we are trying to source the samples from a couple of institutes and places, the lab where they're testing this COVID-19. But we are not getting the permission for that. That is one of a hindrance to that. Yeah. And speaking more about the virus, see this COVID-19 comes under the class 3 category. So there are class 1, class 2 and class 3 category of viruses, wherein it is categorized based on the envelope that is coated upon the virus. So this influenza virus and major viruses that we are trying to kill, that comes on the class 1 category, where it requires around 36 joules of the energy. But for this COVID-19, it requires much less joules, like 3 times less joules. But what we are doing in our UVC systems is we are giving 400 joules of energy. So within 30 seconds, any sort of an organism will be killed completely.
Just to add to what he said is that a lot of those innovations were being built now. COVID as a virus is not available to be tested anywhere,
Yeah.
right? It was originally with the ICMR lab, and it is not to share. So for a lot of these innovators, it is important to validate as close as possible because the access to COVID-19 is not there. So they are doing as close as possible in terms of the viruses which come closer, which are available in other labs. And then based on that, they can go to market. And then as and when COVID-19 virus becomes available, they can test it. But it's going to be difficult to test it immediately because of the access to that.
Yeah.
The story remains the same for another startup, which is almost to get access to that. That is Biomoneta, which is also has been building a phenomenal device which works on the combination of aerodynamics and textile to put together to say that how do you reduce the microbial load in environment. And it's a very exciting work. They were largely looking at the pathogens which were, the bugs, in which you call as bacteria, which are rampant in hospitals and causing secondary infections. But times like this also allow them to look at, see how the technology can be addressing the viral loads which are there. So I'll have Arindam come in now and share their effort.
Thank you, Taslim, for the great introduction and also for selecting us as one of the stars of the second week of this CIDA program. So Biomoneta is a technology building house. Biomoneta build devices around its patented ZBox technology, which synergistically combines antimicrobial materials, specialized electronics, aerodynamics, to reduce the hospital acquired infection, the route of transmission, and so on. So so effectively any decontamination technology should focus or should have three key attributes. One of them is the ability to kill pathogens instead of nearly trapping them. The second one should be it should be able to operate alongside a patient continuously and safely. And third point, which is probably the most important, it should have very less manual intervention. So any filtration based technology, people have proven over the years that they are inefficient because they cannot kill pathogens, they cannot kill bugs. Whereas devices which are based on UV and ionization based technologies, they cannot be operated alongside the patient and they require a lot of manual intervention. ZBox technology on sense is very unique. It's a plug and play devices. It doesn't require any manual intervention. It has very higher efficiency in terms of the amount of microbe it can reduce. So right now we have shown that in an enclosed chamber, we can reduce more than 1 billion microbes in less than 10 minutes. We are very fortunate to have awarded multiple national level research grants which allowed us to take this device to clinical settings, to hospitals, and we have shown that in hospital ICU settings, our devices could reduce close to 95 to 99% of microbial load, both from air as well as from surfaces. We have validated the technology against viruses, viral particle, and of late we have been interacting with the Principal Scientific Advisor's Office, which has taken this technology, and we are about to commence our study with other virus which are very close to, structurally, morphologically very close to coronavirus. Uh, yeah, so this is where we are. We are just waiting to accelerate our manufacturing process, and we are very hopeful that our devices will be very helpful in preventing the transmission of all these viral particle in hospital settings, as well as other environmental pathogens which can effectively cause secondary infection in COVID-19 positive patients.
Tell me
So yes,
something. Have you tested this?
yes, we have clinical. We have done all these clinical validations in hospitals in Bangalore. We have done all these testings in various research labs in Bangalore and throughout the country. Our devices are deployed in multiple places in the country. Various IVF centers. One very famous IVF center in Mumbai. Multiple research labs in the country. So on.
As you rightly said, and this secondary infection issue is worldwide, and nobody has brought answers to that. And that causes the problem is that those secondary issues sometimes are very deadly because of the resistant patterns that they carry. And same would be the case with COVID. When you are there for something else and then you pick COVID, it'll be really, really bad. So reducing the environmental load of the pathogen will be the key. And I hope that this innovations from Biomoneta Leafbox will be able to serve that. I'll quickly move from here to another innovation we have picked, which is more of a surface and body aspect of it, which is Clensta, which is very exciting work. Originally built for sanitizing individuals when they are on a far away adventures and water availability is not there. But it gives a much higher level of the cleanliness and hygiene when you have this issue, which you can use it for multiple ways other than the sanitizer itself. So I request now a colleague from Clensta, Puneet, to share a little bit about your work.
Hi, Shraddha. Yeah, hi. Our solution is quite simple. Okay, so we have been working in this field, personal hygiene, from last 4 years, right? And the whole idea was people should be able to maintain personal hygiene without water. So thought was bathing without water, right? So with that focus, we started this company, and the whole idea was so if we can do it, there are a lot of people. People like you and me are privileged. We have access to water, but we have been thinking patients who are hospitalized, soldiers who are deployed in extreme conditions, right? So they don't have those opportunity and to maintain personal hygiene the way we have been actually maintaining. So with that two objective, the whole idea was conserving water. Secondly, maintaining personal hygiene on go anywhere, everywhere, right? We created this base technology. I call it waterless technology. It's like an Android. Okay, so you use any phone, you can use Android platform. So likewise, it's a waterless technology. Now we implemented in head bathing. So even a lot of working women, my female friends, so they have been using dry bath previously. Okay, because maintaining head hygiene also is like quite tough. And alternatively, whatever was available so far, it's more like a dry shampoo, and dry shampoo was more like a beauty product, and we wanted to be a hygiene product. So there was a thin line. Dry shampoo was also meant for waterless bathing, but it was for beautification. It was more like, if you take a bath from a dry shampoo now, you have to take a bath tomorrow. Okay, you can skip for a day. Our idea was that for as long as 6 months, we were not thinking you take a bath with water. So we were thinking that one should be able to take bath without water as long as 6 months, because in Siachen, 90 days, people don't take bath. Average stay in India for a patient is almost 5-6 days. So for 5-6 days, we met a lot of hospitals, starting from Medanta, AIMS, RML. When we started, so we started in IIT Delhi. So we spoke to them and we understood that everywhere so far sponge was considered actually for personal hygiene, and they have been mixing chlorhexidine in the water, and nursing staff was dipping same sponge again and again in the same water, and contaminated water is being used on the body. So hygiene is ruled out in that case actually. So now I can proudly say more than 500 hospitals adopted this product. Let it be AIMS, Medanta, RML, Kokilaben, lot of hospitals have adopted. Our product was mandated by Indian Defense. Every soldier who is in different difficult condition like Siachen, submarine, Ladakh, desert, so they're supposed to take bath from Clensta. That has been kind of a circular patronization has been done. So we implemented in two category. One was head bath, another was body bath. So these two products we were talking for a body bathing, and another was a hand sanitizer. I mean, since we are waterless category, so though there is a lot of range of waterless product we have, but these three products we commercialized. One is head bath, body bath, and hand sanitizer. Fourth product, we recently won a grant from Big, which is BIRAC, 50 lakh grants. That was for waterless toothpaste. So it was like, if you're on go, hiker, or even a patient, as I said, I mean, dental hygiene was ruled out. 87% people have been compromised on dental hygiene, at least on all those areas in India. So this waterless toothpaste, again, the product was, it's a safe to swallow formulation. Even it will help and improve your acidity problem if you will swallow it. So we have been thinking around all these waterless category, and these 4 or 5 products, which is like our flagship product, we have been doing from last 4 years. We have a wonderful team from IIT. Professor is involved. 2 professors are involved. We have Vinay, who's online. He's PhD from IIT Delhi itself. We have a Kamika, so from ISC Bangalore. So this is what it is. And now, in case of COVID, how I see an opportunity here, to help people. In fact, I wrote to Arvind Kejriwal for, I found we have been talking about washing hand 20 times for 20 seconds till the happy birthday song doesn't end over. But people end up forgetting, they're opening a tap for 20 seconds and keeping it open. And they're not closing for that 20 seconds. And we found a lot of slums, there is no water availability now. Okay. So I see a kind of a, maybe since if lockdown will increase, there can be a serious issue on water conservation. Actually, we need to think on this part. Secondly, where isolation ward has been created, right? Like railways, for example, right? I don't know from where the water will come, and personal hygiene is important. So I think, so in that case, I believe this can be pretty much useful, because 20 milliliter is good enough for controlling your microbial growth. And like, it's a very scientific engineered product. We have done testing in a lot of places, in research institute, third party, in-house. So you can control microbial growth for 24 hours. It's a very scientifically engineered product, patented. So I believe multiple use cases I found, and therefore we have been thinking, where we should implement. I've written myself to railways all across.
Going forward, see, while I think it makes a huge sense in terms of the frontiers and the Siachen and all that, which is sure. But going forward, we'll have to have products which allows us to use less and less of water.
Yeah.
A lot of them, like he said about toothpaste. I think we will come towards that, and the conservations will be a very important aspect. So such technologies are going to be crucial for many reasons. So we have 2 more, and I think again very interesting ones. Of course, they both come from a non-chemical approach in terms of sanitization. But again, something that has been approved by the Ministry of Ayush for licensed product, which can allow them to, clean the surfaces. So we have 2 now, which is, again, as I said, the surface cleaning is also as important. So we have Yogic, which has a product called sterilise wipes, which uses this to ensure that surfaces are clean and prevent them from being infected for as long as possibly 4 days. And I think those details are very important, because while you can keep cleaning the surfaces, if you can prevent further infection on the surface, it is much important. So I'll request, I think, Ms. Beena, Dr. Beena from Omixgen, to tell us about their work.
Hi, good afternoon. Thank you for inviting this, first of all. I'm from Omixgen. Just that our product is Smart Lice. We started it as a gadget wipe first, because just that we did certain experiments on 200 people, and our study, actually we were shocked to see the microbes that we are carrying along with the objects that we are holding on our hand. So seeing that only, we formulated a very simple and very, if I say, all our FDA approved components in it, and to lyse these organisms, and even it is delaying the colonization for next 4 days. So just that we went for a patenting of that product. And meanwhile only we were thinking, why don't we introduce it as a sanitizer also, because it don't have any harmful effects. All the components are FDA approved. So it is with if I say it is with less alcohol, it's not like 80% or 90% alcohol. It has only 30% alcohol in it, so that our hands are in continuous usage. It won't hurt us a little more like just alcohol. So we have found that even on surfaces, if you spray it, it's delaying the colonization there for a period. So that when we have planned to make it as other sprays also. Now the two things that are in market, just that we are into the market, if I say, but still we have problem with our drug licensing because this is not the WHO formula. So that is why my application has stuck there and I can't move forward with it now because it is not the correct formulation what WHO has approved. So I need a support hand for that actually to get through those things. Then definitely this will be very helpful because it has very less alcohol content. So accidents because of alcohol can also be prevented. And at the same time, this will delay of almost 4 days. We have result of 4 days delay in colonization. It's already already in market. Then only this drug licensing issues came in. So just that I holded it because without a license I cannot do the sale or marketing of it. So just that I am holding it. We got actually for the same formulation we got Dettol's Purpose with Challenge Innovation Award also recently. So I thought this is a very good thing that it should be in the market now, because that is the condition now. Everybody is looking for sanitizers, no raw materials. This one, it is just a combination of certain chemicals, ionic compounds. So we don't have any scarcity for that compounds even. So that can also be, actually we can take care of it. So, but it's not in the market, unfortunately, because I have not got the drug license yet. Okay. But nobody is there for me to help to get a correct SOP for a sanitizer to be in the market. What is the SOP for this clinical trials for sanitizer? That also I have not got in hand.
Yeah. So we can definitely, help you out. Please be in touch with my colleague. We can have a separate dialogue with you and see how we can identify what is the correct protocol for you to get approval. Because sometimes the communication gap is the major issue rather than the procedures. So I think let's do that. I think in a day or two, please be in touch with my colleagues and see if we can together understand what is required, and we'll then push and request authorities to see what can be done together. Yeah. But I think it's amazing work. It's very exciting. It's based on a large, scientific concept of cell lysis. So it just makes a lot of sense in terms of taking care of organism by breaking them apart. So I think this is very exciting. Thank you. So we will go to the last one now, Shraddha, I think, which is again by a company which is called OMG Innovations, which is a spray which, and Nisshant is here, which is a spray called Whiff Spray, which again, I think we have very intentionally taken a few which is important for a prevention, which attempts to do that. So Nisshant, if you can share about your work in terms of the ability of Whiff Spray for sanitizing the environment and the surfaces.
Okay. So first of all, good evening to you, Shraddha and Taslim, and thank you for having us here. Having known that I'm the last person, I know so much information has gone into your head, and I'll try my best, kind of not to be repetitive. But just wanted to give you a background of the startup and then of course the product. So OMG Innovations was founded by Mr. Amul Behel. He's an MTech from IIT Delhi. He's not a doctor, so he's an MTech from IIT Delhi, but has been researching for 24 years into plant extracts. Now he has developed a portfolio of products whereby external application of plant extract based oils, they're treating an internal ailment. So when he went in for clinical trials. So as a matter of fact, being Ayurvedic products, being topical application, nothing to ingest, we went in for allopathic clinical trials where polycystic ovarian syndrome, osteoarthritis, primary dysmenorrhea, menstrual cramp are the 3 of the 7 that have already come out. So we are saying that okay, polycystic ovaries, 8-week application, and you get your ultrasounds done. And as a matter of fact, as part of the trial, it showed that 38% of women could conceive after it. So that is the background with which he comes. It took 22 years of research. 4 years ago, he went commercial with the clinic and has a portfolio. And as a matter of fact, as his second rounds of clinical trials, there's going to be a natural antibiotic, diabetes, and Alzheimer's. So of course, idea is to first monetize this, because it took a huge amount of chunk for him to get the other clinical trials done. But yes, we are out and we are working on the same. Whiff Biospray is basically a patented technology, and I have the bottle here with me because I have used it at home also. It's a patented technology with, again, natural plant extracts. The entire science being of plant extracts, and that is his research. That has potent antimicrobial and antiviral properties. Now, we are saying that, okay, COVID is a droplet infection, which they say that, okay, spreads through surface and the air, because there are some droplets when you cough that fall on the ground, while some, extend in the air for some point in time, which means that air and surface and hands need to be looked into. So Whiff Biospray becomes a comprehensive technology where, say, in a room of 150 square feet, you can spray 1.5 ml, right? That will neutralize the disease-causing bioagents in the room. As a matter of fact, I had spoken to a few corporates, and I said, okay, what problems are you facing right now? And practically they said, see, Nisshant, fumigation, we don't know whether it kills viruses. 2, there is a strong smell when we fumigate. 3, when we have to spray it, we need to shut down offices. And 4, if someone new, because in office spaces you have people coming in and out, they say, okay, if someone new comes in today and they sneeze, your fumigation goes futile. And fumigation can't be done every day. They're doing it once in 15 days. So Whiff Biospray is basically, you can, as you saw, a bottle that can be kept with you in your offices, can be sprayed on a daily basis without having to shut offices. And it is also reduces the respiratory distress, right? So the air, it neutralizes the bioagents in the air, and the same can be used on a surface. You spray it on a surface and you clean it. You'd be interested to know that Whiff Biospray was not actually created for COVID. It was presented as a technology that could prevent a bioterror attack. Because in a bioterror attack, you have a large, or in a possible attack, you have a large array of viruses that can be spread into the air, and you don't know what exactly is the concoction. So because of the potent antibacterial or broad spectrum antibacterial or viral properties, it can help to neutralize, if you spray the drones across the city, it can help to curtail the infection and prevent it. The same thing can be used in your houses, in your rooms, in hospitals, and of course, workspaces that we are talking about. So that is kind of what Whiff is about. It's just that COVID happened now, but yes, the technology has been there since a while. And idea is to test it further and further on varied, virus strains, so that we can show that not only for COVID, but there is an array of viruses that it kind of covers. And though I know it's not a part of the proposal per se, because I had only 1,500 characters, but we have submitted a treatment for COVID that is with the ICMR currently, and hopefully when line of testing where protocol and sample has been sent to them, where external application of our antiviral oil is there to treat the ailment. And how, though we haven't tested it on COVID, yes, as you rightly mentioned, I saw you saying that, okay, the strain is not available for general public, but the oil was developed for RNA enveloped viruses, which is your dengue, chikungunya, H1N1, H3 and 2, of which coronavirus also belongs. Having treated those family of viruses, we know that application under the feet, and on the 4th day, you can do your virus inactivation test in the patient. So having a comprehensive kit where you have surface, you have air, and you have for the treatment as well. So hopefully soon enough we shall have a breakthrough on the treatment front also. There's that much that we can do, and yeah, I think that's kind of about it. And if you have any questions, so there's neem, there's star anise, there's geranium, lavender, ylang ylang, oregano, clove, citrus and mint family extracts that are kind of there inside it. So it's a mixture of 21
So
odd
you're saying that all these mixtures can control COVID spread?
Correct. So the oil that I was talking to you about, right, which, and I think Dr. Amritanjali had asked me that, okay, you are showing that it is NABL certified lab, it has been pilot tested by AIMS, but you're showing drug resistant bacteria, because the reports that have been sent to camp show that, okay, they're effective on drug resistant bacteria. So she said, okay, viral pe kaise hota hai? I said the oil that we have created for antiviral infection, which is what I was talking about, the oil that has been submitted for the COVID treatment and has treated HPV, which again reports that I've submitted, and your H1N1, H3N2, the same extracts that give that oil the antiviral properties are the ones that have gone into the spray as well. So idea is to now test it on, as a matter of fact, the spray is with a Japanese lab to be tested on adenovirus and influenza A. And we were not lucky enough, but we found a lab in Ireland that has a surrogate what they call it, surrogate coronavirus strain. And we said, great, let's go and test whiff on it. And by the time we finalized stuff, the lockdown kind of happened. So we're eagerly waiting. If not the coronavirus strain, at least the surrogate that they have, we can test it on that. And the other thing also that I think I forgot to point out was that Mr. Bell was invited to the conference on transnational terrorism that happened in India, where 27 friendly countries participated there. So it was organized by the Indian Defense Think Tank. And from there, when they heard the idea, and he was probably the only civilian who was invited. So from there, they took up the idea and they said, okay, let's publish it in a defense journal. So it has a journal publication. And now we're looking at further testing of it on various kind of strains, so that we can say, hey, not only a COVID, but even if there is spread of an Ebola, maybe if there's a airborne epidemic that happens, you can contain the spread of it.
And I think as the issue of the excess of the strain, but because they have some studies on bacteria as well as, if I'm not wrong, some animal viruses.
Yes, foot mouth disease is something that we prevented in Mohali government. They called us in Mohali. There was a shed where they had 4 cows that had FMD, which kind of spreads. So they said, can you prevent the spread? We said, we will only prevent the spread if you allow us to treat the 4 cows, which we did manage to treat, of course, again by Sudarshan AV oil, which was applied on their spine. And we have again reports to that effect. And whiff biospray was sprayed so that it doesn't affect the other cows, because it kind of travels through air.
Excellent. Thank you.